Hi, I am Amber Poron, the Outreach Coordinator with Enroll Virginia. Enroll Virginia is a network of community-based, not-for-profit organizations committed to helping Virginians access high-quality, affordable health coverage. Our navigators and enrollment experts are trained and certified to provide free, unbiased assistance with health insurance options available through healthcare.gov, Medicaid, and FAMOUS. We work throughout Virginia to educate consumers about the health insurance marketplace at healthcare.gov and provide free application assistance to people who need our help. We offer free in-person help in your language and in your community. Trained professionals are available to answer questions over the phone or in person. I'm going to go over some of the health insurance options available to you as displaced workers and generally as Virginians. Let's start with maybe the 5 things you need to take away from this session today. Explore your options as soon as possible. You have a limited time, generally 60 days after the loss of insurance from your employer, to make a decision about what you're going to do going forward. Gather the information you will need to apply for coverage. This is going to include information about your household and household income for this year and the remainder of the year. Obtain documentation about your loss of coverage. Obtain information about your COBRA options, particularly the cost, so that you can compare your COBRA with other options that are available to you. And finally, contact Enroll Virginia for any assistance you may need in helping you make an informed decision about what your best option might be. COBRA is simply a continuation of whatever existing health coverage you have or had with your employer. Some important things to remember about your COBRA coverage are that without your employer helping you pay for it, it can be very expensive. But it is something that is available to you if you choose to use it. That means the same coverage that you currently have, the same doctors, the same pharmaceutical providers, the same cost for all your services that you've been experiencing under that plan. The main difference is that you're paying 100% of the premium costs after your employer coverage supplement ends. If you decide to enroll in the COBRA coverage, you have a 60-day window in which to decide to take it or not. And what that means is that from the last day of your regular coverage on the job, you have 60 days to make the decision about taking COBRA or not. If you wait beyond that period, you will not be able to enroll in the COBRA coverage. You'll have to choose one of the other options that are available to you. That same 60-day window of eligibility applies to any coverage that might be offered under a spouse's employer plan or that of a parent if you're under age 27. Another option that we can discuss is the Virginia Health Insurance Marketplace under the Affordable Care Act. Just remember that if you have an offer of coverage under a spouse's employer plan, you may not be eligible for financial assistance. I'll discuss that in a minute. It is a complication that's probably something you want to discuss with one of us navigators. And finally, I'll talk about Virginia Medicaid program. Just to remember the key points about COBRA coverage. COBRA is a continuation of the health insurance plan you enjoyed while employed. In most cases, you're going to pay the full premium cost for COBRA coverage. You're going to have the same doctors and policy features, and there are factors that might make COBRA coverage preferable. You also have 60 days to enroll in COBRA coverage after your loss of coverage at work to have retroactive coverage. Make sure you gather the information about your COBRA so that you can compare it to your other options. For those of you who choose not to take COBRA, another option you may have is through healthcare.gov or the Virginia Health Insurance Marketplace. That's who I represent as a navigator. Your loss of the affordable coverage offered through your employer is a qualifying event that makes you eligible for a special enrollment period, also known as an SEP. An SEP allows you to enroll in coverage through healthcare.gov outside of the regular open enrollment period, and to take advantage of a special enrollment period opportunity, you must enroll within 60 days from the date of any qualifying event. This SEP also applies to enrollment in a spouse's coverage at work. There are a number of SEPs associated with COBRA coverage even after you enroll in COBRA. We've already discussed the SEP when you become eligible for COBRA coverage and the first 60 days after the loss of employer coverage. You may also enroll in the federal marketplace if your employer is subsidizing the COBRA coverage for a period of time and that subsidy ends, making the coverage unaffordable. During open enrollment each year in the Virginia marketplace, you're allowed to drop COBRA coverage and enroll in coverage in the marketplace. Outside of open enrollment, if another qualifying event for a special enrollment period occurs, like moving or getting married or having a child, you may enroll in coverage through the Virginia marketplace. What you can't do is drop COBRA coverage outside of open enrollment without another qualifying event and enroll in the Virginia marketplace. What's nice about healthcare.gov is that it's a one-stop shop where you can apply for financial assistance, compare plan options, and enroll in a plan all in one location. There are two different forms of financial assistance available through the marketplace. The first are premium tax credits, and what that means is that when you apply, you will be determined for an amount of tax credit based upon your income. And typically, the way it's structured is that the less you're making, the more help you're going to get, and those tax credits can be used to lower the monthly premium of whatever you decide to purchase. Or, if you choose to, you can delay that credit till the end of the year when you file your taxes. There's no waiting period for coverage to begin if you make a timely application. So just as a simple example, let's say you did your application and you qualify for $450 worth of premium tax credits. In whatever plan you choose to purchase on the marketplace, you can lower that monthly premium by up to $450 a month. Or you may choose to add that credit to your tax return when you file your taxes at the end of the year. Most people choose to take that tax credit every month, but the option is available to you if you want to wait until the end of the year. There's a second form of financial assistance that's available to you through the federal marketplace, and that's called cost-sharing reductions. How those work is that even when you have health insurance, typically when you go to the doctor or the pharmacy, you still have to pay something for the service. When you go to the doctor or pick up a prescription, you still have to pay something for that service on top of just having the insurance. What cost-share reductions do is reduce the amount that those copays might be. So if normally to go to the doctor your copay is $20, or to go to the pharmacy and pick up a prescription the copay is $15, that cost-sharing reduction will reduce that doctor's visit copay to $5 and the pharmacy visit to $3 for the prescription. It lowers the cost you pay when you actually use the services that are covered by the insurance. Another way cost-sharing reductions help is by reducing something called the maximum out-of-pocket and your deductible. How that maximum out-of-pocket works is that you're using your insurance during the year. The portion that you're paying out of your pocket is tracked by your insurance company, and once you meet that maximum out-of-pocket, from that point forward, the insurance company pays for all of your care that is covered under the policy. Most people have a maximum out-of-pocket of $8,000 or more. With cost-sharing reductions, that could be reduced to as low as $1,000 or less, meaning that once you spent $1,000 out of pocket, including meeting your deductible or any other feature of the policy, the insurance company is paying for the remainder of your healthcare costs for the year. If you need major surgery or have an accident, it doesn't matter what care costs. Once you've met your out-of-pocket, the insurance company is paying the remainder of the bills for the rest of the year, other than your premium for which you're also getting help. To be eligible for the financial assistance in the Virginia marketplace, you must project an annual income range for your household above 138% of the federal poverty level. What counts in income are earnings from work, self-employment, investments, and in general, it's the income that you report on your federal income tax return as your adjusted gross income with modifications that add back some non-taxable income reported on the return. If your household is under 138% of the federal poverty level, adults in the household may be Medicaid eligible, and under 205%, children may be Medicaid eligible. A household may have some members who receive Medicaid coverage while others will be covered on a marketplace plan. The higher your projected income, the less premium assistance you will receive. Two ways to apply for financial assistance, select a plan, and enroll in coverage through the Virginia Marketplace is through healthcare.gov website or through the Marketplace call center. The phone number is 1-800-318-2596. The call center is available 24 hours a day. It is more convenient to create an account online through the Virginia Marketplace at healthcare.gov because it makes it easier to compare plans and to see what the features are and check the provider networks before you decide what coverage you want to choose. Remember that you only have 60 days from the loss of your employer coverage to enroll through the Virginia Marketplace. And in order to preclude any gap in coverage, it's much better to enroll prior to your loss of coverage during that 60-day special eligibility period before losing your employer coverage. The next thing I'm going to talk about is Virginia Medicaid. Virginia Medicaid is an eligibility-based program primarily based upon income in the household. For most adults, that is a monthly household income of about 138% of the federal poverty level, but for children it is higher at 205% of the federal poverty level. I'm going to focus mainly on adult Medicaid, but much about what I discuss applies to eligible children and pregnant women because it's possible that individuals in the same household may qualify for one Medicaid program when others will qualify for other coverage options. Virginia Medicaid is full coverage. It includes comprehensive benefits. There are a choice of 6 different private managed care organizations that you choose, usually based on the network of providers that accept the insurance in the area where you live. You can apply for Medicaid any day of the year. Enrollment is always open and there is no waiting period before benefits begin. Your coverage begins the date that you apply as long as you're found eligible for coverage. Here are two charts to show you income eligibility for Medicaid coverage. One on the left is for adults ages 19 through 64. Note that there is a monthly income amount in the left-hand column of the chart. Medicaid financial eligibility is based upon your monthly income rather than the annual income that the Virginia Marketplace uses. But for the purposes of eligibility, the Virginia Marketplace annual amount can provide a benchmark for other purposes. You can see in the chart on the right the monthly income that determines the eligibility for Medicaid coverage for children and pregnant women. From this, you can tell that a household of 4 with an income of $4,000 a month, while the adults would not be eligible for Medicaid coverage, the children would be. If the children are covered under Virginia Medicaid, any money you save in coverage for them can be used for the rest of the household. Taking a look at that same family of 4 with an income of just above $3,000 a month, the whole family would be eligible for Medicaid coverage. The really nice thing about Virginia adult Medicaid is that zero cost coverage, no copays, no out-of-pocket costs for covered services. Another convenient thing about Virginia Medicaid is there is no period that you have to enroll, no time limit for applying. If you apply and meet the qualifications for enrollment, your coverage begins immediately. There is no waiting period. Remember, with Virginia Medicaid, you can apply any time of the year. Eligibility is based off income and state residency, and children and pregnant women have a higher threshold of income for eligibility than adults. There are many different ways to apply for Medicaid in Virginia. When you apply for coverage in the federal marketplace, you will be screened for eligibility during the application process, and if you or any members of their household are Medicaid eligible, their application will be transferred to the state of Virginia for processing. You may also apply directly through Covered Virginia's call center or online through Common Help at commonhelp.virginia.gov. Things that you should take away from this are those 5 things that I mentioned earlier. Explore your options as soon as possible. Gather the information you're going to need to apply for coverage. Find out what your COBRA options are. Compare COBRA with the other options. And if you have any questions or need assistance, call Enroll Virginia Navigators to find someone close to you to provide knowledgeable and free assistance during your research and the enrollment process. Again, those numbers for contact information if you would like to reach out and apply directly through the Virginia Marketplace. For the healthcare.gov is the website healthcare.gov or 1-800-318-2596. If you would like to apply for Medicaid, you can apply through coverva.org online or call their call center at 1-855-242-8282. You can also apply online at commonhelp.virginia.gov for Medicaid. If you need assistance with either your Medicaid application or your Marketplace application, or you're not sure and just have some questions about comparing your COBRA options, you can also reach out to find a local assister through Enroll Virginia. You can go online to make an appointment directly at www.enrollva.org, or you can also call our toll-free number 1-888-392-5132. You'll be asked to input your zip code, and then you'll be connected to the closest local navigator. We can provide services in person or by phone or video conference through Zoom, and we'd be happy to answer any questions that you have while we provide free, unbiased educational assistance, and we can also help you through the application process through whichever door you decide to take. Thank you so much for taking the time to listen today, and please don't hesitate to reach out if you do have any questions, and we'll be happy to answer you. Thank you and have a great day.